Hi, Dr. Eric. It's Joanne Fisher. My presentation is on the challenges facing the healthcare administration in the 21st century. The healthcare administration of the past is fast becoming a distant memory because of the issues being faced in the 21st century. These challenges spread across several spectrums to include the various changes in healthcare reform, a growing need to specialize in the increased competition for healthcare professionals. These challenges come amid of the fundamental reasons for healthcare: to provide adequate care for patients where the implementation of new legislation, advances in technology, and the shift of patients towards specialized providers. The most significant of these changes stem from the implementation of the Affordable Care Act that expands coverage to individuals previously without coverage. The need to improve the quality of care, provide coverage while lowering the cost, and hold insurance companies accountable for their actions. Under the previous healthcare system, individuals who had pre-existing conditions found it difficult to get insurance coverage, but the Affordable Care Act makes it illegal for insurance companies to deny coverage to these individuals. As a result, these individuals cannot be rejected based on pre-existing conditions. The plan extends coverage to those who were previously denied health care coverage by companies and have also been uninsured for over 6 months. With Medicaid being expanded to provide coverage to individuals with income below 150% of the poverty line. In other words, individuals with a family of 4 that currently earn about $33,000 per year will be provided coverage under the Medicaid expansion. The Affordable Care Act also ensures continued coverage for young adults under the age of 26 that are currently on their parents' insurance plan. Under the previous system, these young adults will have likely been removed from their parents' insurance plan once they reach the age 19. In addition, patients will now have more choices in health insurance and also as well as healthcare providers. Specialty healthcare facilities have grown tremendously within the past few years, and this growth have also increased their popularity as well as become a threat to traditional hospitals and healthcare facilities. These specialty facilities are considered to be facilities with 2/3 or more of its inpatient claims were in one or two major diagnostic categories, or 2/3 or more of its inpatient claims were for surgical diagnosis related groups. And also, they have been the catalyst for the reduction in costs while providing the opportunity for higher quality of care. Catalysts for within these facilities becoming increasingly popular, healthcare administrators are now forced to develop a strategy for specialized care, which means the implementation of measures that would set themselves apart through a specialized care strategy. This would entail determining the type of concentration that should be undertaken while ensuring there is none or minimal competition within the surrounding communities, along with the selection of desired demographics. Efforts would need to be put in place to investigate other specialty healthcare providers in their local communities, identify areas of opportunities, and put a strategic plan in place for building a re-owned specialty practice. Once that is done, staffing the facility with the most qualified professionals becomes paramount. Staffing has now become a major feat because of the shortage of qualified healthcare professionals. Healthcare administrators will have to develop strategies to attract the most qualified candidates because of the increased competition in the marketplace. According to the Bureau of Labor Statistics, healthcare employment is expected to rise 23% by 2018. Yet, administrators are still faced with the task of creating a work environment that offers competitive pay and benefits to attract the most qualified registered nurses, as well as physicians, surgeons, as also nursing aid. The registered nursing field is expected to grow by 22%. Licensed practical and licensed vocational nursing field is expected to grow by 21%. The home health care field is expected to grow by 50%, and the nursing aides, orderlies, attendants fields are expected to grow by 19%, as well as the physician and surgeons fields are expected to grow by 22%. As a result, hospital administrators need to build strong relationships with schools that offer healthcare-related degrees in their local communities across the nations. Additionally, they must make working at their hospital attractive, which means thinking beyond the competitive pay and benefits to ensuring each individual employee feels connected to the hospital and has a passion for working for the organization. Potential candidates have become aware of this shortage and essentially selecting the facility that best suits their needs and work-life balance, salary range, and benefits technology in an environment in which they feel comfortable working and in one that affords upward mobility. There's approximately 78 million Americans considered baby boomers that will be needing health care in the near future, and as such, healthcare administrators will need to prepare for the future. This will present an increased demand on hospitals and with changes in the way they are paid, going from a fee-for-service structure to a model that is based on outcomes and overall quality of care. The pressure is on to make patient satisfaction a major priority. Hospitals that want to expand into specialized care will have to align themselves with the level of care that consumers expect. This addition may include play areas for kids, converting semi-private rooms to a private room, or even putting in therapeutic areas like gardens or waterfalls. With the increase in the amount of baby boomers in the coming years comes the question about quality care to be provided. The quality of care is considered to be the level to which the healthcare services being provided actually meets or exceeds the expectation or the desired outcomes of individuals or populations. The need to increase the quality in healthcare services being provided comes as a result of the various reports within the industry. This also has the component of the professional knowledge that is available through which this care can be promoted. These services include areas of physical, mental, and more often emotional treatments to which our healthcare professionals are being held accountable. Variation of services factors as one reason is a result for more than one healthcare facility in one section of the country performing the same procedure in a different way than another facility in another part of the country. There has also been reports of healthcare facilities performing services that are not necessary and that may endanger the health of the patient being treated. There's also underuse of service where patients did not receive the level of care necessary to treat their condition. In order to be able to measure the level of care being provided, one has to be able to promote improvement to the already established system. The National Academy of Science presents a positive outlook when it highlights that good ways always exist for improving the quality of healthcare. In addition to what we know about measuring high and low quality care, system and management research involving such fields as organization behavioral, statistics, psychology, and learning can be used to evaluate the outcome of healthcare decision and thus influence favorable in the institution and people that provide healthcare services. It is evident that there is the need to improve the ways in which services are and have been provided, and that has to be communicated to healthcare providers in a timely manner, not just around the country, but around the world. This has already been started where it has been reported that organization-wide quality improvement efforts are beginning to be adopted in the services sectors around the world. There are also challenges for healthcare administration to remain profitable, and most of this concern is within the Medicare and Medicaid system. The increase of unemployed individuals have promoted the growth of the uninsured, underinsured in the country, and healthcare facilities are faced with either providing treatment for lower income costs than they before and still remain profitable. Many healthcare providers have limited the numbers of Medicare and Medicaid patients they serve as one way of offsetting the related expenses. The U.S. National Library of Medicine and the National Institute of Health have reported that Medicaid low fees have caused many physicians in the hospital to shun Medicaid, compromising enrollees' ability to get appointments. With this increase, these facilities will have to find alternative ways to maintaining their fiscal responsibility with either expansion in areas of care or in the number of facilities they operate. This includes my presentation in Facing the Healthcare Administration in the 21st Century. Thank you for your time.